Hello, everybody. Welcome to the Corrective Lenses Podcast. It's an outgrowth of the County Seat program, which aired on ABC4 for 11 years. And we try and find interesting things for the communities of Utah to talk about. And one of them has come across my desk and on my radar, and that is a company called Champion Health. Now, I know what some of you are thinking is, okay, great, this is going to be a commercial. But what I've learned about this is a very different program for employee benefits, and it is referred to as a mini health program.
Mini medical, yeah.
Mini medical. And so my guests today are Dwight Christie, who's from the Murray Chamber Board of Directors, Matthew Gibbons, who is a former president of the Murray Chamber of Commerce, and Dustin Sutton, who is the president of Silver Key Benefits, and you're the guys that provide this program locally here in Utah, right?
Yes, currently we are, yes.
If there's somebody who watches this podcast and they're in Hurricane, Utah, are you the guy they call?
Absolutely.
Okay, I'm just trying to set your boundaries.
Well,
appreciate that.
Chad, in fact, there's no boundaries, so we can assist anybody in the U.S.
On some of the notes as we were talking, Dwight, you keep referring to W-2 employees. And so I'm sitting here at as a company and I'm going, well, why does it have to be a W-2 employee?
The reason is that W-2 employees pay FICA taxes, and that's how Champion Health uses that to pay for the program.
This is kind of one of those funny things. You just said FICA, and all of a sudden it's like, that's not where I thought you were going. And okay, they walk in and say this is a really different program, and all of a sudden like, okay, how does FICA play into that?
Well, you know, it's basically it's a pre-tax deduction. So the health plan has a pre-tax deduction that the employee pays into the pool to pay the claims. And so by reducing their overall pay, they're reducing their payroll taxes, which is their FICA, Medicare, and Social Security taxes are reduced from that pre-tax deduction. So what happens is the business actually sees their half go down too. So they save $573.60 to be exact per employee per year for each employee that's on the plan.
And that's just because, I mean, what is coming to mind here as you're talking about this is kind of like the Christian, Medishare type things.
It's a little bit different because the Christian Ministries plan, you don't have to be an employee, first of all. Anybody can get onto it. A lot of the claims...
Not that easy.
Yeah, well, you still have to qualify. But it is a little easier to qualify for that plan than it is for traditional health plans. Right. So the Christian ministry plan is paid for a lot by the members of the ministry or whoever the people are on it. So, you end up with a big cancer bill or something like that. You might not be fully covered on the plan.
Right. Well, I think the point I was getting at is that they play upon that ability to apply monies not as an insurance benefit, but rather as towards an actual expense. Am I reading that correctly?
Well, no, actually, the Champion Health Plan is qualified under Section 125 of the tax code. So it has all of the things that you need for the Affordable Health Care Act, and so that it's an actual health plan. So it's not just a claims, that may or may not be paid into a pool. These are actual medical expenses. There's a defined coverage that it comes with. And, the coverage is pretty good. I mean, you can go see a primary care doctor for zero copay, and it's all under the First Health Network. So we still use a network of doctors and things like that. The amount that's coming out is a little higher on the pre-tax deductions, but they're getting a credit back for taking care of their health, being proactive with their health. So as they're answering questions or watching a video on their phone with our app, that will qualify to generate what's called a CPT code, which qualifies under ACA and all of the Obamacare and all of that stuff. And that is what generates a credit to their paycheck. So they get a pre-tax deduction, but then they see credits for doing all of the tasks that they're supposed to do, which is like once a month. It takes like 2 minutes. It's really nothing. It takes no time.
So if I'm understanding this correctly, Champion is actually encouraging them to be proactive in their health care, I guess with the aim of cutting the claims profile. A lot of people just never really stop to consider that claims rule rates.
Yeah,
And
that's
it's
absolutely
just like,
right.
oh, it's a rental car. You know,
Yeah.
It's the same sort of thing.
Well, and this is going on the county seat channel. So this is a huge benefit for all of the counties in our state. So most of the counties are probably on a self-funded health plan currently.
A lot of them are. Or they participate in the state's health.
Okay. And if they're not on a self-funded health plan currently, they probably ought to give me a call, because that's probably some way that they can save a lot of money on their health plans. But the great part about the Champion Health Plan is we can put this with whatever health plan. It doesn't change or replace any of the coverage that they have currently. They can stack it right on top of what they've got now, and it'll reduce their claims because they're going to be using, the Champion Health to go to their primary care doctor. So it takes the claim off of their major medical. So that helps keep your rates lower. And so that's a huge benefit. It has a lot of different benefits to it, including veterinary benefits, and you got a lot of counties that are in rural areas. I talked to a woman in Arkansas last week, and she looked at that. It's a virtual veterinary benefit. And she said, well, I have horses, and I just called and I used my virtual benefit on my health plan, and it cost me $300 or something like this. You're telling me that I can do this for free? I said, well, yeah. How many horses do you got?
So the counties that would see this are going to, they most likely, they're either going to self-fund or they're going to be part of the Public Employees Health Plan, PEHP.
That's correct.
And you're saying that this will fit in front of it and,
yes,
and change their risk profile and their rate profile on PEHP.
Absolutely. It is imperative to know, and it's crucial to understand that this does not replace any of your current coverage. Now, there's always a good reason to look at it, right, to make sure that you've got competitive rates. And if you're not on a self-funded plan, I'm sure that we could probably get you some better rates. But regardless of all of that, the Champion Health works with those current plans. It's not working against them. It's working with them.
I suppose then if people are self-funding, this is probably something they should be paying more attention to, because it sounds to me like if you pay the claims that I'm hearing you say you're paying, more on the preventive health side and the doctor's visits and likes, that's actually going to reduce their risk profile. Is that correct?
Yeah, absolutely. It's, we cover all of the things that ACA requires, which includes all of your preventative health, mammograms, colonoscopies, all covered 100%.
And let's not forget prescriptions.
Yeah.
Cover over 200 free.
Well, they're between $0 to $1, but 85% of them are free, no cost at least.
Okay, this sounds really good. This sounds great, okay? But I'm sitting here at home watching this, and I'm going, there's got to be a catch in here. There's always a catch. What is the catch? I mean, you've been involved from the chamber, right?
Yes.
Okay, and this is something that was of interest to the chamber.
That's correct.
I would like to hear your perspective on this, Dwight.
It is not too good to be true. It is formulated through the Section 125 tax code, and it's been in use for over 7 years now.
I still don't understand it. Could you explain it?
Yes, I sure can. The CHAMP plan is a self-funded, self-insured Section 125 cafeteria benefit, and that allows for an employee to reduce his gross pay on a pre-tax basis in order to buy certain medical benefits. This is an employee with a $5,000 gross pay, and he has elected to go with the CHAMP plan. So under the program, his gross pay is reduced by, in this case, $1,200.
Well, that sounds like a lot off of a $5,000 at first blush.
Yes, it does. But what it does is it lowers his gross to $3,800, and then the taxes each get lowered based on $3,800. Once that's done, then the CHAMP plan kicks in with paying a benefit for using the CHAMP plan. And so that's the benefit of 11, let me see this a little closer, $1,130. And he comes out with $4,102.78 net, as opposed to what he had before, which was $3,966.87. This plan is a preemptive plan. It's teaching people how to be proactive on their own health. So when they sign up for the program, they get an app on their phone and they set it up based on their own health profile.
Okay, I get that, Dwight, but I still have a question because businesses don't actually participate in cafeteria plans, so the benefits don't pay for them. How does it work for the company?
Now, this works similar to for the company, although they're not getting their taxes lowered, they're getting their payroll taxes lowered for each employee. So the employer will save $91.80 per employee per month, but out of that amount, they pay $44 per month to the CHAMP plan for an administrative fee.
Right.
That nets out to the employer $47.80 per employee per month, which results in a total of $573.60 per employee per year.
Got 100 employees, all of a sudden,
Yes.
you're throwing a heck of a Christmas party all of a sudden.
Absolutely. I think a company of 100 employees is considered small, but almost $58,000 a year, they can do a lot with that.
Okay, I think I've got it now, and this is making sense to me, but I just want to make sure that the viewers see it, because if we don't get past this part and they get a grasp of it, the rest of this is not going to make a lot of sense. So let me see if I've got it, okay? All right. The employee's making $5,000 a month. He's paying $512 in federal income tax. He's paying about $135 for Social Security, and he's paying $72 for Medicare. Another $300, $340 for state income tax. So his take-home pay currently, without participating in the plan, he goes home with $3,966.87. So now he gets on the CHAMP plan, and right off the top, he's going to give $1,200 of his income to the Champion plan as a prepaid benefit into a cafeteria plan. It's tax-free under the ACA. So now his income has dropped from $5,000 to $3,800. And now we start to tax. Well, that means that the federal income tax has gone from $515 to $312. And he's gone from 135 Social Security to 102. He's gone from 72 in Medicare to like 65. And he's gone on state income tax, he's dropped from 310 to 235. So he's actually saved quite a bit of money on taxes. Now, because he's on the back end of the payroll period, he now is getting credits added back to his paycheck because he participates in the proactive part of healthcare through the CHAMP plan. So they're going to give him a $1,130 credit back. They're going to bill him $120 for the premium to participate in the plan, and he's now going to take home $4,102.78. So he basically is he's basically making $200 or $300 per month, and the premium's already been paid. So his cash benefit, cash in pocket, is up, and he's got all these other services like primary health care and prescriptions and veterinary, and that was kind of a surprise, prescription service, all these things that he's got to climb on a deductible on his major medical, and he now is getting those through the Champion plan. But now on the employer side, the company doesn't actually get to participate in the cafeteria plan, but they do see the tax savings. So they've got an employee, taxes are reduced. They are actually saving in taxes they have to pay as an employer contribution. They're saving $91.80 per month. That's $537 per year per employee. All right, that doesn't sound too big, but if you have 100 employees, that's $57,000, and that's nothing to kick at. And if you have 1,000 employees, well, that's like a major budget. That's a big deal. Am I missing anything here?
I gotta interject here.
Yeah.
Matt is the former president of the Murray Chamber of Commerce, and so he's involved with this because I brought it to his attention because we are working with chambers of commerce all across the country currently. Matter of fact, we're onboarding Miami-Dade County right now, which is one of the largest counties in the country. And so they're all onboarding and getting involved with the CHAMP plan as well as their current medical plan. But I think it's important that Matt talk about, how many chambers have you talked to?
Dozens, probably 20 across the country.
What, do they call you because they hear that Murray's behind it? And
Yeah, there's been we've had a flyer created that had our logo on it, and somehow it ended up in South Carolina. I have no idea how. And so they would call to inquire with us.
It's probably a conspiracy, Matt.
It is. If I'm involved, it for sure is.
I've had a call from New Jersey.
It's just I just look at it, what's the biggest challenge in a small business? Most businesses that start out, they last 5 years, if they're lucky, unless they are forward-thinking or implement some things to help do what? They need to retain employees, they need to attract employees, and they somehow need to increase their revenue.
Okay, that leads me to a question. I'll probably throw this back at you.
Sure.
If you're trying to attract employees, how do you get them to pay attention to?
I guess the last study I saw, that most employees are leaving their current positions over a few dollars, and it's not the money, it's the benefits.
Right.
Because it's a giant expense for them. And so...
And perhaps even a bigger, it just seems overwhelming to them.
Yeah.
I mean, I honestly think that if I didn't provide health insurance and had bumped their payroll up to compensate for that, it would not have provided the incentive for them to stay that actually give them the health coverage, because it's kind of overwhelming sometimes.
Well, and likely they're not disciplined enough to take that extra income and apply it here. They're going to go do whatever.
Right.
And so now they're still behind the eight ball.
Well, to your benefit, or to your point there, Chad, for the county seats, or even for businesses, it's a retention tool, right? If you could provide any form of healthcare, I mean, we've got small businesses that they can't afford to provide anything, any health care. But there is a law that once you reach 50 employees, you've got to provide a health plan. Well, this health plan qualifies, right? This health plan will help retain employees because you are able to give them some form of health benefit, and it's not costing you anything, right? It's all paid for by the tax savings it generates. And in the cases of the county, there's only so many ways you can generate income for the county. Like every single county in the country is struggling with budget concerns, right? So what are you going to do? You're going to raise taxes, property taxes, sales taxes, lodging, those types of things, or intergovernmental transfers, federal, state grants, mandated program funds, charges for services, licenses, usage fees, court fees, or other revenue, fines, asset sales, and our investments. Well, those are the only ways that you can really generate revenue for a county. So we're introducing a whole nother thing, which is healthcare. Let's look at your healthcare. That's a huge line item is healthcare. And so if we can help counties resolve their budget concerns, or at least help with their budget concerns by reducing some of their health costs, that's going to save them from having to raise taxes or do any of those things that I just discussed.
Well, most of their income streams are not, you can't count on them.
Well, that's true.
So, of course,
you write enough speeding tickets in Manaway,
Yeah,
the
but
state
that's
legislature will take away your ability
Right.
to raise money for speeding tickets.
Right, but even getting grants from the federal government, that's not guaranteed. The only thing that's guaranteed is maybe the property taxes. But maybe I can sum the CHAMP plan up pretty simple, and I look at it from a small business perspective, maybe 100 employees.
Sure. Uh-huh.
Number one, the employees get the benefits that we've been talking about that are going to help them be healthier. The next part is the employer is going to see a reduction on his payroll tax expense by about $600 a year, the $573.60 we've talked about. Per employee per year, which breaks down to $47 a month.
So a company with 100 employees is going to save, $57,360 per year. We talk about a county, for example, that has 1,000 employees. That's $573,000 in savings. That's huge. That is game changing. That is a huge line item on their budget. So there is zero reason why anybody that's listening to this shouldn't at least reach out and get with us to find out if this works for their situation, because we can walk through and show you step by step how that tax savings works. All we need to generate a proposal for the county or the business is a payroll report. Last payroll report that shows all of the W-2 employees, just the last pay period with their deductions, and then we put it into our system and we generate a quote.
So from those deductions, or when they give you the payroll report, you're able to see what they're already contributing in health insurance in their primary coverage.
That's exactly right.
And it's gonna go a step further and show that business exactly how each employee is going to be impacted positively. It's also going to show them exactly how much the company is going to save.
Okay, back to being Mr. Skeptic.
Sure.
Because I've got viewers who are skeptical. How is this different than Aflac? How is this different than like Penn National? Because they're kind of in that same supplemental insurance space, and I'm trying to understand.
Well, you just answered your own question. You said supplemental insurance space. Okay, they're not primary insurance. So they are they're called indemnity plans. Aflac is an indemnity plan. It's great plans. We work with Aflac. We love Aflac. But it's an indemnity plan. So it covers certain things, right? And may give you a cash payout on those certain things. That's indemnity, okay? It's not a major medical plan. It's not a plan that qualifies for any tax deduction because it's not ACA compliant. It's not qualified under Section 125 of the tax code. Those are the differences between CHAMP plan and those types of plans that you're talking about.
See, that's just the part that kind of throws me for a loop, because I'm just not familiar with ever hearing that before.
Well, it's a new program, right? That's why we're here, because no one's really heard of it before.
But that was indeed the point that I wanted to get across, is that I haven't heard of it, and I'm not an expert like you guys are, but
up until about 4-5 years ago, I hadn't heard of it either. Okay, and I've been in the insurance business for 20 years, and I've never heard of it until 5 years ago. And the plan was actually developed by a couple of guys that used to live in Utah, but they live in Arizona now. And so they developed this plan because they saw a need for small businesses to be able to provide health insurance. They saw a need for to help businesses generate more income through tax savings. And they designed this plan, and it's phenomenal, and it checks every box.
So all three of you are involved in the process of getting the word out about this. And you're probably talking to a bunch of reasonable skeptics. Nobody likes an insurance salesman to come by, and I realize that you guys are with the chamber and everything, but it's like, oh, come on, What is the one point that they're most concerned? People, when they talk to you and you get far enough to get into the conversation, what's the one point that they're most concerned with?
Well, I think the skepticism comes from lack of awareness. Anything that's new, everyone's going to be skeptical.
Yeah.
Right? And so things that have been out for a while, their skepticism is going to drop. And the only way I know how I've come over any kind of skepticism is to test something and see if it works for me or not. It's that simple to me. And so just like any other new business, so because we're part of the chamber and we talk to so many business owners, and their biggest thing is we want more money and we need more employees. Well, the reason they don't have either one of them is nobody knows they exist. And so this falls under the same criteria, in my opinion. And it's just about there's not enough people that know about it or that have talked about it, that are out talking about it with their other business groups.
Well, you do run the risk, because I just had this with another topic on the show. You do run the risk that people are talking about it, and they're talking about it incorrectly.
The one thing that I like is that any business or any entity with W-2 employees can test drive the program for 30 days and see if they like it. If they then don't like it, we'll end it.
Wow.
Yep. We do have a 98 or 99% retention rate on the plan since it started. So people are not getting off of the plan. Most of the time that the people are dropping is because they're quitting their jobs or they're leaving the companies or whatever, but no businesses have really stopped doing the plan. So it's largely, it's very largely popular, and people are excited about it. People are seeing the changes, and they're exploring what the benefits and saving money on their checks, and it's great.
So, do you think businesses sometimes fail to take the time to inform their employees about all the great things the company's doing? I mean, you just handle the health insurance. They say, yeah, I'll sign on for the health insurance, but they don't really take the time to understand it. Is that?
Yeah, I think that's a fair statement. But the great part about this particular plan is the employer doesn't have to do anything. We'll do it all. So the only thing that the employer needs to give to us is the payroll report. Once we have the payroll report, we can generate the quote. Once you receive the quote, you can accept the offer. Okay. And once the offer is accepted, we do all the work. We do all the onboarding. We process all the claims. All the claims are done through a phone app. They're not done through your administrator or your HR department. We take all of it.
So I'm out there, I'm a business, and I've come to the conclusion, the guys that bought my recreation show, I used to do my own payroll. I mean, QuickBooks used to do my payroll.
Right.
Okay. They've hired a payroll service, and the payroll services kind of bundles up some stuff for them. How does an employer access that? Do you work with payroll services? Is that something you can get worked out?
Yeah, actually, some of our major partners are payroll services. So many payroll companies like Paychex and Paylocity and ADP, Allstate, iSolved, Payroll Vault, they're all very familiar with the CHAMP plan. And if you're working with one of those or any others, we work with hundreds of payroll companies. And if you're working with any of those, chances are they've already implemented a CHAMP plan on somebody's payroll report. So they're familiar with the program, and they know how to implement it, and it's pretty seamless.
You have a cheat sheet for a payroll company that hasn't done it yet?
Oh, yeah, we do. I mean, it's not that difficult to process it.
So one of my problems, and again, I only have the experience of supplemental insurance. But it was hard for my employees to understand what it was and how it worked. It's just one thing we said, okay, our major coverage, the deductibles are getting higher. This is why we decided to do it. Deductibles are getting higher. It's getting harder to stay in the silver plans. It's costing a lot of money. So because you're having more out of pocket, we're going to add this program. But I didn't really have anybody come in and really, I mean, they onboarded with us. My employees never knew how to use it. How do you solve that problem?
We train them. So what we'll do is, depending on the size of the company, if you're got several employees, we'll be right there on site. We'll bring them each in. We'll help them download the app. We'll show them how to use it. We'll help them fill out their first healthcare or health assessment. And we'll get them started on the program and explain everything on how it works. So we're heavily involved in making sure everybody understands how this works, because we're all invested in this, right? I mean, it's important for everybody to understand.
But this is a proactive program.
Absolutely.
So somebody signs up on it, they're going to get some savings, but they also have to bring a little effort to the table.
That's correct. So it's very minimal effort. So basically, you have an app on your phone. You're going to get a message that pops up saying, oh, you need to do this task by the end of the month. The task might be watch a video or answer a short survey or, schedule an appointment or something like that. The task takes about 2 minutes or less. As a matter of fact, I'm on the Champ plan myself. So as being a sponsor of it, we get to use it ourselves. So I was shocked at how short it took, how the minimal time it took to fill out my little survey or do my little assessment. To keep my plan active. And so, you get reminders that if you don't do it, it'll remind you on your phone. Things will pop up on your phone saying, you don't forget to do this. That's what generates the credit back from the pool for filling out those surveys. And so it's important that everybody does that part as well, but it doesn't take much time.
So do employers have a risk if it's not implemented? I know that you can get in trouble if you don't do insurance right. What are the risks on this?
You guys want to answer that one?
I don't see a risk at all. The risk is not doing it because of the incredible tax savings benefits. For me, it's a no-brainer. I got 100 employees. I'm giving them better access to help them be healthier. They're getting an increase on their take-home pay. And oh, by the way, I'm adding almost $60,000 a year to my bottom line that I can reinvest in my company to help it continue to grow. I've never seen anything else do that, ever.
How many employees do you have?
Do I personally? I don't have any employees.
You don't have any?
The chamber doesn't have employees.
Okay.
I'm the president's the only paid employee at the chamber. Okay. Most chambers have 3 or 4 employees.
I'm sorry to interrupt you, but we have the Greater Idaho Chamber of Commerce on this. They have 10 employees, and they're all active and on it.
So we've talked a lot about counties and municipalities and everything, but this is equally viable to a company with, say, 25 employees.
Yep. We can go down as low as 5 employees.
I'd have barely qualified.
Yeah, you would have barely qualified.
Well, I have a great case study on that front in an industry that is extremely difficult, and their turnover for employees is extremely high. It's a cleaning business, home cleaning business. They're chamber members. They have 7 employees. The moment he implemented it, he saw his turnover for his employees reduced to almost anything, and his employees loved it because they got to have some kind of a benefit that otherwise he couldn't afford. Couldn't afford it.
Right. So, are there chambers that are sponsoring this as a benefit to their members? Is there that kind of a relationship?
I'm sure there is.
Well, like I said, the Greater Idaho Chamber is.
That's what triggered my thought.
Yeah, and we're contacting. Like he said, not every chamber has paid employees, and so. The ones that do, we're approaching those chambers, and we got many chambers across the country on the plan currently.
I know that in a lot of cases, having been involved with trade and professional association management through the years, that quite often those nonprofits, which would be similar to a chamber, would look at things to retain membership. And insurance is one of the big ways to do that by pooling stuff together and providing programs. Can Champion work in that space?
Yeah, it could be. I mean, we framed it as a chamber benefit because you're a chamber member. You can have access to this program to help them do what it does for the business. And And the way I thought about it is to offer it to non-members to invite them to be part of the chamber community, to be a member.
Now, it sounds like, Dustin, that Champion pretty much takes care of everything. So if somebody really seriously looks at this, like Paiute County, their HR department is one part-time person because they're a really small county. Right. Okay. And they would look at this and go, oh my gosh, how do we administer this? Is administration a big burden that people have to calculate?
Not at all. Like I said, once we do the onboarding, we administer the program. So your HR director really won't have much involvement other than if an employee leaves and a new employee is hired, they need to inform us of that. Other than that, there's really no work on their end to process any claims or you don't need a TPA or anything like that. We do all of it.
You got any other thoughts about this? I mean, you obviously answer a lot of people's questions, and I've probably given some of the dumbest ones.
I think yours are great.
Great questions.
There you go. Oh, not this one again. Is there anything that I missed?
Well, I do want to say that, going back to your point about skepticism, I couldn't agree more with that. I've run into that multiple times in my career with this product, with other products, all kinds of things that we do and market. The cool part about this is I've seen this work. Matter of fact, we had a person that was on the plan. We had a meeting in Scottsdale, Arizona. Okay. And we were at this fancy resort, nice pool and everything. We were going through meetings basically on Champ. It was pretty interesting. Well, one of the main vice presidents of the marketing company for Champ nationally, he got sick. He wouldn't come out of his room. He's a good friend of mine. I'm like, dude, what's going on? You should come out and hang out with us. Let's go do some stuff. He's like, oh man, I am sick. And he's just, he sent us a video, which I won't show because you don't want to see it. But anyway, he didn't look very good. He ended up getting strep throat. Got strep throat, but he was on the Champ plan. So what did he do? He called his that has a virtual primary care benefit on it, called the virtual primary care doctor. The doctor prescribed him a prescription for, some kind of amoxicillin or something. I don't know what it was, but it was on the formulary. So he didn't have to pay anything for the doctor visit, didn't have to pay anything for the prescription, and it was delivered to his door at the hotel within 30 minutes. And that's the plan in action.
Sam's Club, look out.
Yeah, right. I was shocked at how fast he got it.
That.
I know. I was really shocked at how fast that happened. And he might have had to pay Uber or something to bring the prescription to the hotel. I don't remember that part.
Wait, this bottle's half empty. Do you know what that was?
Exactly. But anyway, it was delivered to his door, and he's like, man, I'm living proof that this plan works. And so that's pretty cool. The other thing is it does have another benefit on there. One of the top 5 claims against health insurance right now that's hitting health insurance plans is mental health. Mental health has just skyrocketed into a huge, huge thing. In the world we live in, it's not surprising, right? But anyway, this has a benefit for the employee and their entire family, where they can have proactive medical care to help identify potential risks with a mental health care consultations, unlimited consultations for mental health care, that's pretty phenomenal. I mean, that's a huge, huge line item on the major medical plans right now. So to take that off of your major medical and use the Champ plan, that's going to reduce your benefits or reduce your, the cost quite a bit, the claims quite a bit.
How did they make that work? I mean, the reason that the big health providers are dropping the mental health coverage is because they can't make the costs pencil out. And yet here's a mini health plan or whatever moniker you want to put to it, and it's able to accomplish this.
Well, because it's a mini medical plan, it doesn't cover all the major stuff, right? So we're not covering cancer. We're not covering all of those types of things with this plan. So we can dump more money into these other benefits. So which really helps to alleviate the claims off of the major medical. Because most companies every year, when they see their medical renew, right, their medical plan renew, they're seeing 8, 10, 18% increases on their medical plans because they're using the plan. Well, the plan's there to be used, but if we can keep the workforce healthier by doing proactive, that's what this app is all about. Hey, have you felt this? Have you done this? Tell me about this. If they can be more proactive with their health, they're going to remain healthier. They're going to have more work days. They're not going to call out sick as much. And they're going to take those claims off of the major medical, which hopefully will reduce the increases that you see annually.
Well, colonoscopy is a great thing. Everybody hates their colonoscopy, but man, making that push has saved a lot of money.
Well, I had my first one, and it was the best sleep I ever had.
You thought you were asleep.
Yeah, that's right.
That doctor heard things from you that probably he thinks are hilarious.
He sent us the recording. He just doesn't know it yet. It's going to be a big surprise on his birthday.
Right.
Well, guys, thank you so much. This does help clarify things quite a bit. So,
can I add one more
please do.
perspective of this? Because I've been in the trucking world a long time ago. This plan is extremely beneficial for industries like the trucking industry. There's some high risk industries their insurance is outrageous. So imagine having the Champ plan in front of that. As a trucking company, for example, they've got guys traveling all over the country who are probably not the healthiest people in the world. And what happens when they don't feel good or get sick? They're laid up in some random hotel or at a truck stop.
I was going to say, and they're not home. And that Phoenix story kind of drives home that point.
And how are they going to be able? Yeah, because he's from Iowa. So how are they going to be able to access anything?
Huh.
So from the trucking company's perspective, it's helping their employees immensely, but it's also reducing the claims against their major medical. It's probably already outrageous anyway because of the industry they're in.
Yeah, that's true.
So anyway.
Well, all I can say is that if anybody watching this wants more information on this, please reach out to us. We'll leave our information with you, and you can flash it on the screen.
Actually, it's already there right now. You just don't know it yet.
Oh,
It's
okay.
right there.
There it is.
There it is, down below.
But anyway, reach out to us because we'll go into a deep dive on this. We'll go through every single specific. We'll show you exactly how the payroll savings are calculated. Through charts and we'll go through every single benefit on the plan and show you how the app works. So it's pretty simple.
I guess in my experience, the biggest gap between businesses getting involved with Champ and not is because of how long it's taking them just to simply submit a payroll report through a secure link. And that's literally all they've got to do to really see how this is going to help their business.
Yeah, the payroll report, if they're using QuickBooks, it's a click of a button. All you do is just download your last payroll statement with the W-2s, and then you upload it through our secure link, and that's really all there is to it. If you're working with a payroll company, they know exactly what to do, and so they can send it to us. That's really all we need.
Have you ever had any payroll companies try and talk them out of it?
No. Mm-mm.
Okay. Fair question.
Yeah, no, that is a fair question. But
well, on that subject, and this is kind of maybe a little bit of a challenge. The bigger businesses that have insurance brokers and stuff like that, they're talking their clients out of it because they have no idea about this program. And it's not a threat to them. In fact, it would help them retain their customer by having the Champ plan on that with them.
Well, thank you so much, folks. You've got the information to contact them. We'll also leave a printed link on our YouTube page so that you can easily access it. We appreciate your tuning in to the County Seat and our Corrective Lenses podcasts, and share this with your friends. This is a good one to share because, if you're in business, you've always got to be looking out. I know this for a hard fact. And so remember, we will be back again for another look through Corrective Lenses at the issues that face us. Have a good week until we meet again. Thanks. Thank you, guys.
Thank you.
I appreciate it.
That was great.
Good.